Hey everybody, welcome back to the Teach Back method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we're going to be talking about components of research design. Let's break it down. There are many different elements of research design. Here's just a few. We have, what approach are we going to take for our study? What is the time frame on this? How are we going to group our subjects and individuals? What's the format of our study going to be? And what are the controls that we're going to use in our study? When we're trying to decide which approach we should take, there are two main ones that we can determine between: qualitative or quantitative. These are concepts you're probably already familiar with. So with quantitative, we're taking a look at numbers. We're looking at different variables and looking at numerical data. With qualitative, we're not looking at numerical data. Rather, we're more so looking at the why or how. With the time component of our research design, there are different avenues we can take. Let's check it out. First, we can determine between retrospective or prospective. Retrospective is taking historical data, whereas prospective is data taken in real time. Additionally, we can take a look at a cross-sectional study versus a longitudinal study. A cross-sectional study is data taken at a single point, whereas longitudinal is taken at multiple timing points. It's important to remember with a longitudinal study, although it's taken with multiple points, it's with the same group of individuals, not different groups. The components for grouping are pretty self-explanatory. We can have one group or more than one group. Self-explanatory. So if we have one group, we can do a cross-sectional or longitudinal. So we're looking at one group and one point in time, or we're following this one group over different time periods. If we're doing more than one group, we can do it the same way, cross-sectional or longitudinal. If our design involves more than one group, we can break it down. So, if we're doing more than one group, we can do between subject grouping or within subject grouping. Between subject grouping is comparing measures across different groups, whereas within subject grouping is repeating different measures within the same group. So within is within one group, between subject grouping is different groups. The format of our study is taking a lot of these components and combining them together. For example, with our format, we can do a quantitative study, which we discussed with our approach. There are many different types of quantitative studies, and if you are interested in learning about the differences within each one, comment below and I can make a separate video on them. But for example, we can do a systematic review, meta-analysis, randomized control trial, cohort study, case control, cross-sectional, or case series. The last component I would like to talk about today are controls within a study. Controls are very important because they help to control any bias or outside influences that can affect our study. These are a few examples of things that we can try to control within the study. Subjects, how are we recruiting them? Are they the same type of patient, etc.? Equipment, are we using the same brand of equipment? Are we doing different equipment? Environmental conditions, is this performed in the same clinic or the same research lab? Testers and training, are we doing one tester for everybody? Are there different testers and they're getting different types of training? Data collection, how are the testers collecting the data? And then communication. I hope this video makes sense. Come back to my page to learn more.